Hello, everybody. Good afternoon. Thank you for the introduction. Thank you for having me here today, and thank you all for participating in this. When I last saw the list of attendees, it looked like about 24, 25 people had logged in, which is, I think, a perfect size for having a nice conversation today. So as was stated before, please don't hesitate to put questions in the chat as we go. I will have plenty of time at the end for questions as well, but don't hesitate to stop me as I go. I tend to have the habit of talking pretty quickly, especially when I get excited about something, and I'm excited about this work. So I think odds are good I will end up talking quickly. So a little bit more on who I am. My background is in aerospace and ocean engineering. I was an assistant professor and then an associate professor at Virginia Tech from 2004 to 2015. I then went to be the executive director of the American Society of Naval Engineers for a few years, and then returned to academia about a year and a half ago, where I'm an associate professor now in mechanical engineering at George Mason. So my technical areas of interest are in vessel dynamics, chaotic systems, CFD, autonomous systems, and transitioning research to practice. And for the most part, a lot of my work has been Navy supported. I've done some work for the Coast Guard, some NSF work, a little bit of NASA, and some occupational safety related work. The reason I'm bringing this up, I'm just trying to show a little bit of my background research and how it's not COVID related, and then kind of weave through the tie as to how I got into this path, and then talk through the tool that we have at hand. So the sort of work that my grad students have been doing is often very applied math-ish. I had a student, Juan Wu, who was trying to do prediction and verification of simulations that would lead to capsizing or other chaotic problems. So for those of you who have ever been on a boat, capsizing is when the boat just flips over and is actually a chaotic problem. Had another student who did his master's thesis trying to predict how much damping there is in a roll problem. I've had a student trying to work with autonomous systems. That's what you see on the left here, where we're trying to predict the motions of a host vessel and see whether or not we can capture an autonomous vessel that's driving up behind it. And then that sort of segues into some of the occupational safety type work, where we start to say, okay, well, if we're getting better at predicting ship motions, can we do tools that fishermen would find useful? Can we give them a real-time vessel monitoring system, vessel motion monitoring system that runs on their phone, which is what this is a screen capture of here to the right. And then, as I mentioned, I've done a lot of work that's sort of Navy or boat focused. So we do quite a bit of computational fluids. I had a postdoc who was trying to couple different types of fluid simulation, which is what this dam break simulation is that you see here, where we've got two different ways of simulating water and air going at once. We've looked at flexible structures in a flow. If any of you have any sort of Navy background, we were kind of inspired by the T-Craft program, which at the time was a large hovercraft program that the Navy was considering. And then we did some work looking at what happens when you have an explosion underwater and have that hit a structure. This student, Van Jones, is actually a current student of mine, and we had some undergrad researchers helping there. Those of you who are in academia can probably imagine the fun conversations that you have with undergrad students when you say, who wants an undergrad research gig that lets you blow things up underwater? You end up with getting to pick from some of the best and the brightest students, because everyone liked blowing stuff up underwater. Just getting through all these videos. Had some NASA work where we were looking at putting an underwater vehicle under the ice on Europa. So if you and any of your side interests involve following what NASA's been doing in searches for extraterrestrial life, there are a lot of people who believe that our most likely target of opportunity will be Europa. And then I had a student who was taking some of the CFD type modeling that we've done and applying that to modeling air traffic, and whether or not we could do a model of air traffic in the National Airspace System that accounted for uncertainty in ways that hadn't been captured before. So the reason that I'm showing you that is, you're probably saying, if you had heard a little bit of my bio at the introduction, you see that, you say, how does somebody who does ship dynamics get involved in COVID-19 modeling? So why should we listen to this person, and what's her tie to this? And so my tie to it is that I love modeling and simulation problems. And as it happened in March of this year, I had work-related travel that was supposed to take me down to Panama and Colombia. So on March 5th, the university that I work at suspended all international university-sponsored student travel. I touched base with the powers that be and said, hey, I'm not traveling with students. Am I still cleared to go, or should I be staying home? And they said, nope, you're clear to go. So on March 8th, I hopped on a plane out of Dulles, headed to Panama. On March 10th, the university suspended all travel effective March 16th. And that also was the day I got that email as I was leaving Panama to go to Cartagena, Colombia. On March 11th, as I'm in Colombia, having seen State Department warnings that Colombia was starting to flag US citizens as potential disease vectors, the WHO declared COVID-19 a global pandemic. I decided to hop an earlier flight to Dulles from Cartagena via Panama that night, actually, which proved to be a good decision because within the next day or so, there started being the epically long lines of people trying to get back into the country. March 12th, the governor of Virginia prohibited out-of-state travel for all Commonwealth employees. That was the day I was actually scheduled to return. Or that was the day I was scheduled to head to Barranquilla. Actually, I was supposed to spend a couple more days there in Barranquilla and was scheduled to return back to the DC area on March 14th. March 16th, Colombia closed its borders and Panama restricted entry to citizens and residents. And March 22nd, Panama, which is a major international thoroughfare for Central America, suspended all international flights. So what's going through my head as I board that first flight, there's plenty of news coming out of China and increasing worries in the US on that first day at the start of the pandemic, but everybody's talking about how there's enhanced cleaning. It was still in the time where people were saying, don't bother with masks, that masks weren't going to do anything. And so, I'm sort of doing my best. I bring Clorox wipes and hand sanitizer with me. And as I'm boarding that first flight, as I sit down, I notice cash under the armrest in the row in front of me. And I was thinking to myself, okay, so much for everything I've heard about increased cleaning. I can't imagine any airplane cleaner left cash in plain sight. That's just not how people work. So I'm, watching people board and noticing how people just touch everything. And I start wondering how quickly could something spread through an airplane by contact? And I'm was aware of a lot of wonderful research that exists looking at aerosolized flows of, coughs and germs from previous pandemics, and now also from the COVID-19 pandemic of, how do aerosols travel through a plane and how do HEPA filters filter that out and so on. But I was kind of interested, and again, this was very early in the pandemic, so we didn't really know how much was spread by aerosol versus contact and so on. I was wondering how quickly could something spread through this airplane by contact, especially if there's subpar cleaning. And I was wondering whether or not I could model that in some of the same ways that I've modeled my fluids work. If I go back a slide or two, this fluids approach, the ones that you're seeing in these center videos, instead of being what's sort of a more common fluid simulation approach where people mesh an entire domain and look at how fluids move as sort of a continuum, this is actually smooth particle hydrodynamics, where you treat each fluid particle as a particle, and whatever is going on with that particle can influence the other particles that are around it, but the further you get from the particle where you are, the less the influence is. And so I said, okay, this looks like an SPH type problem. It's, if you're sitting really close to the person who has COVID, then you're probably at greater risk. As you are further away, then you have less risk. And so I was kind of curious as to if we could create a very simplified model, essentially an agent-based model for anybody who's in the modeling and simulation world, that ignores the aerosolized part of it, but is just trying to do sort of a tracking proximity and contact between people in a very computationally efficient way, so that we could start to account for the fact that some people are healthier than others. Some people may have pre-existing conditions, where a sick person sits on a plane and whether or not other people happen to be seated near them might have an influence. In those first few weeks, we started really quickly seeing news about how airlines were going to eliminate use of middle seats. By the time I got to my return flight, even a few days after my first flight in March, people were using their Clorox wipes to wipe down the seat. And I was just curious as to how much of an influence that all could make. And if you saw my State of the Science presentation, I showed my simple aircraft model And about 15 minutes before that presentation, I thought to myself, oh, I shouldn't have done this for an airplane for this audience. I should have shown what it would look like for a bus. Because, while we may not be, this audience may be less concerned with air travel, if we're talking about farm workers, regularly we are moving farm workers in buses. And so this is a example, hypothetical, initial ride of a bus. And so every passenger on this bus I've got indicated with a blue dot. So you see blue dot, blue dot, blue dot, blue dot, and so on. 2 initially sick passengers are marked with the red X's. So there and there. Can you all see my cursor, actually, as I move it?
Yes, we can see your cursor. Mm-hmm.
Excellent, thank you. And then based on sort of proximity and whatever the baseline health of the people around it was, these 2 initial infections end up causing 11 other people to be infected, which are the red dots around it. And you can even see, in some cases, this person who was sick, this person who was kind of near them apparently was healthy enough that they were able to sort of be resistant to this person's illness, versus this person was less likely or was less lucky. So the number of things that are randomized in this, I've got for each simulation, the number of passengers aboard any given flight, or in this case, any given bus ride, is randomized between 1 and the seating capacity of the vehicle. The number of sick passengers is also randomized. The seating locations of the passengers and where the sick people are sat is also randomized. The baseline health of each passenger is also randomized. And then I can also assess the impact of whether or not people clean their seats, or if you eliminate, for the bus model, I eliminated aisle seats, saying, okay, well, if we want to try to space people out more, we encourage people to sit by the windows. And so there's a lot of stuff that's variable in this. So walking this first simulation through, if I take this bus ride and then say, okay, well, it dropped off that group of people and picked up another group of people, but wasn't cleaned at all. So I've got a handful of seats that are the open red circles that are potentially contaminated from the prior inhabitants there. And now I've got people again sitting where there are blue dots, and people who become infected based on sitting somewhere where somebody had coughed heavily and potentially left germs behind. And again, I'm not saying that this is necessarily an accurate current model of the COVID-19 as we know it. Is purely just trying to sort of track contacts and get a sense for how this would evolve. Again, with what we've learned about aerosolized flows, this is even more simplistic than what I was intending at the time. But so this was after the second bus ride. I've got the third bus ride here in the middle, where you pick up another couple infections, actually a bunch of infections, and then the last bus ride before it gets clean down here at the bottom, where you pick up a bunch more infections. And as you see, it's different numbers of people on each ride, different locations where they're sitting. All of that is randomly driven. But where this comes into play, where the simplicity comes into play, why it's useful to do this type of very simplified model, is we can do a ton of simulations in a very, very computationally efficient manner. So if we do an 8-ride sequence, I can do 10,000 iterations on this, where every time for every one of those 8 rides, every one of the 10,000 iterations upon the 8 rides, so 80,000 bus rides being simulated, there's a different number of people on it. There's a different number of initially sick people. There's different health characteristics for each people. I can model a very broad swath of hypotheticals, and look at what will happen. And again, the sort of factual number of comparing number of infections is not necessarily accurate because it's a simplified model, but comparing the impact of a mitigation strategy becomes very powerful. So what I'm showing here is a look at what percentage of the people are infected. So that's the vertical axis versus the total number of infected passengers and how many percent are there, for a case where no one wipes down their seat and a case where everyone wipes down their seat. So on the left-hand side, where nobody wiped down their seat, I see that 97% of the simulations resulted in more than 10 infections, versus the right-hand simulation where everyone wipes down their seat. And actually in this one, we also don't use aisle seats. So there are less people on each of these bus rides as well on the right-hand side. I see the vast majority of the cases, 99.5% of the cases resulted in 10 or less infections. So again, this is not an apples to apples comparison, and it's admittedly very simplistic. We're not modeling the aerosolized behavior. We're assuming it's just a proximity driven spread, but it's not intended to be a predictive tool. It's intended to be able to assess a mitigation strategy. In this case, the mitigation strategy being not using the aisle seats and having everyone wipe down their seat. And again, you can start to extend this even further if we wanted to say, okay, well, we've moved people to different farms, and then we start to track them on their farms, and we are looking at the kind of entire domain that's before us. So that brings me to the farm itself. I started working with the good folks at the Northeast Center for Occupational Health and Safety, who, when I had this initial airplane model, said, well, that's great. Could we do a similar approach for farm housing? And as I think y'all know, 10% of crop workers in the US enter on H-2A visas. Employers have to provide housing for those workers. And it's critically important for the safety of those workers and the security of the food pipeline that we try to keep those people as safe as possible. And since many of them are living in dormitory style workforce housing, the challenge becomes greater because we have people who are living, who are working and living together kind of constantly. So I ended up modeling this in two subdomains. One that was the evenings, which is just trying to model, where they are when they're sleeping, and it's proximity based, just like this airplane or bus model, where each individual has some random baseline health. I randomly assign which bed that they're sleeping in. We kick off the simulation with one sick resident in the room. If anyone becomes infected because of that sick resident, we treat them as asymptomatic for some random number of days within predefined guidelines. We end up using a Gaussian distribution using mean number of days to illness for COVID-19 and sort of what the standard deviation is for that asymptomatic period. And in the daytime, I use an SIR type model. So we presume the model kicks off with that first evening, there's one sick resident. Either somebody becomes infected that first night or not. They go to work the next day. We presume the sick individual is identified upon arriving at work that day. Their temperature is taken or they show symptoms. They are removed to quarantine. And then we continue the simulation there forward. If there was anyone who is infected, they are asymptomatic and potentially spreading it through the community using this SIR daytime model and proximity-based nighttime model. So going on to the next bit, if you haven't seen SIR models, S stands for susceptible, I is infected, R is removed. We have a total number of individuals, some infection rate, and some recovery rate. There are a lot of different variations to this. SIR models have been around for about a century. So there are a lot of ways to model this with greater complexity, births, deaths, reinfection, and so on. I did not include any of those complexities. Though what makes this a little bit more complicated is most SIR models that are out there, there are simulations, for example, for hospital environment that are on websites. The Penchine model is one that people tinker with a lot. But a lot of those aren't really designed for using really small sample sizes. And so if you're talking about a farm that maybe has 4 or 5, 6 workers, a lot of these models start to break down. So we had to do a little bit of modification to a classic SIR model just to treat people as integer numbers of people. You can't say I've got 2/10 of a person who's sick, because that doesn't make sense to have 2/10 of a sick person. So for this work, the goal was really to provide an education tool for farm owners and farm workers. It again was not trying to be an exact prediction, was just trying to be something that could be a useful tool so people could get a sense for how doing some basic interventions on their farm could improve the safety of their farming environment. And so it really was a close partnership with the folks at the Northeast Center for Occupational Health and Safety, who have medical professionals and epidemiologists and who work with farm workers day in, day out. They're actually in Cooperstown, New York. So some of their staff do have farms. And so through that collaboration, we were very careful about choices of phrasing on the website, for example, to make sure that we were using language that would make sense and resonate with people. As you could probably tell from this, I talk like an engineer. I am an engineer through and through. And so, being able to work with a team that has better communication skills for the target audience is really useful. We also realized that at least in the Northeast, there's a non-trivial number of farm workers whose first language is Spanish. So we wanted to make sure that the tool was multilingual, so that somebody who English wasn't their first language would still be able to get the same benefit from it. We wanted to make sure that it had a user interface and design that was friendly to a user, and that we picked a coding language that would make it so it could be readily used. And what I mean by that is the first version of it I wrote in Matlab. So Matlab isn't a useful tool really to anyone in this community, right? It's not like people have Matlab on their computers. Sorry, I'm gonna pause, take a drink of water. So this is what, the start of that code looks like when it's an engineer designing an intervention tool, because I'm just thinking in terms of Matlab. But as I start talking with the Northeast Center folks, we said, well, we should really make this be a web page. And we want the simulation, because the perk to the simulation is it's very computationally efficient. Let's make it written in JavaScript so it can run in somebody's browser. We can just stick it on the web. People don't need any specialized software. They can just type in some parameters and run whatever they want. You can see even in this version, so this had some Northeast Center input on kind of layout and wanting to show a floor plan, but it's still very much engineer speak language. The sorts of terminology that made sense to me were talking in terms of the stochastic simulation, saying I'm going to do 10,000 runs. At least one person is infected 80% of the time, 16% of the residents become infected. Which again is maybe a little bit more mathematical approach than what people are really looking for. So, sorry, I was pulling up the webpage. I'm going to go to that in a second. But the current version of it is much more graphically appealing, many fewer words, just really trying to make it an interactive, aesthetically easy to work with tool. And so with that in mind, I'm going to go ahead and pull up these websites and we can walk through what the tool looks like. So the original version, and I do still have the original version up on my website for people who might be interested in viewing it in this little bit more mathy way. But there's introductory language. The simulation tool is designed to show how easily a virus can spread among farm workers based on room size and how beds are arranged in their housing. It also suggests alternative room arrangements to help prevent or reduce the spread of illness within a shared space. We have a simplified model of farm worker housing, so results shouldn't be viewed as exact predictions. Again, trying to give that warning to people, but just trying to present a tool for seeing how small changes can make significant reductions in the spread of a virus. So we begin by asking people some basic room specs. So room width, I'm just going to type in 15 feet by 15 feet as a test case. We'll put them in bunk beds. We'll put everybody's head at the wall. We'll run the simulation for 45 days. And we're going to say, hey, people aren't actually wearing any face coverings. They're not great at hand washing, sort of, not doing the most thorough job. There's room for improvement. So we submit that. Give people what the room area is. I throw the code of federal regulations at them, telling them the max permissible number of residents for the sleeping area that they've defined, thinking that might be useful for people to get sort of an affirmation on that. Give a look at what the space would look like. And so for this hypothetical, ran the code where for every one of those 10,000 simulations, a random number of residents between 1 and 5, between 1 and the max number permissible by the Code of Federal Regulations, were presumed to be in the room. One person was sick, and we look at how many people are infected over 45 days, which was the input, and found that for this simulation, at least one person became infected 40% of the time, 13% of the residents became infected. And so if someone's reading this and says, okay, well, I don't want an arbitrary number of people between 1 and 5 residents. I know I always put 5 people in that room. I always use the maximum number for the CFRs. They can plug that in and say, okay, well, if you're always using 5 people or always housing 5 people, one person becomes infected 80% of the time, and 16% of the residents became infected. And then maybe you say, well, I've got bunk beds, so I could actually be putting 6 people here. I might break CFRs, but why have an empty bunk? So they were inclined to stick it to 6th person. They can see 100% of the time, at least one person becomes infected. And so hopefully it's affirming that you really don't want to be breaking the CFRs. When we go to the new tool, though, walking through a similar size space, so let's again go with 15 feet and 15 feet. We'll do bunk beds. And so this was actually with the team, we had a lot of conversations about what did those words mean on this website saying, are people sleeping with their heads at the walls or head to toe? I was the sort of kid who always went to summer camp and was always told to sleep head to toe. So for me, that made sense, but realizing that that was a luxury that many people don't have or didn't have in their childhoods, that maybe that terminology wouldn't make sense. So we gave a graphic to indicate what we meant by heads at walls versus head to toe. So if I've got this collection of people, everyone's sleeping with their head at the wall, I'm putting 5 people in the room. So now I'm not throwing the CFRs at people. That seemed to be information that wasn't necessarily particularly useful or welcome. People kind of know how many people they're sleeping in a room. And they weren't necessarily looking for that to be fed back at them. We can hit submit there and get a floor plan that now gives a little bit more of a graphic of what did this configuration physically look like. We then ask what sort of preventative practices are people using? And again, with images to help with this. So if somebody's reading isn't as strong, they've got some graphics that can help guide them as well. And either which way, it just becomes less wordy and a more appealing picture. So I'm going to say face coverings are provided. Hit submit. And so the output ends up showing a hypothetical result. And it actually plotted one of the worst case scenarios that come out of the 10,000 simulations that are run. So the 10,000 simulations were just run in the time that I hit submit. That's how quickly it runs in browser. This is where a sick person was. They infected their bunkmate, but nobody else wound up infected. So susceptible still means that they are out there in the world. They're not infected. They are so far safe. So we say, based on the information you gave, if one worker in the bedroom had coronavirus at the beginning of the week, and so we also hard coded that this just runs for a week. We didn't ask people how many days they want to run because that seemed to be more in the weeds than people were looking for. The most likely outcome is that one of the 4 workers sharing the bedroom would have coronavirus by the end of the week. And the worst case scenario found in the simulation, which is what's shown, is that one of the 4 workers sharing the bedroom would have coronavirus by the end of the week. And then on this website, we give the user a number of reminders of ways that they can be improving their practices: wear masks, socially distant, be social distancing when you can, clean and disinfect, and hand wash, and then more guidance in words. And then we give the caveat that the results are just meant to show how simple changes can reduce or increase the spread of infection, should not be viewed as an exact prediction. And talking through a little bit of what's going on in the model for people who are interested. So if someone sees this and says, okay, well, what sort of improvements could I make? What happens if I flip my people to be sleeping in a head to toe arrangement? So I click that. Let's run another 10,000 simulations. So already done. And so in this one, we find that the most likely outcome is that 0 of the 4 workers sharing the bedroom would have coronavirus by the end of the week. But the worst case scenario is that everyone gets it. And so when we actually shifted over to this way of presenting information versus the language that was on this page, where I was reporting out, percentages of people who are infected and percents of the time that at least one person becomes infected. Looking at it this way, let us kind of say, well, different people are going to have different value choices, right? Some people might prefer the situation where the most likely outcome is that nobody becomes infected and is willing to take the risk that if anybody becomes infected, everyone becomes infected, versus the all heads at the wall hypothetical, where pretty much all the time it resulted in at least one infection, though it rarely spread to the rest of the community. Let's see here too. Someone wants to violate CFRs, they can see what the impact of that would be. So if we bump that up to 6 people, and let's put them in single beds. So that's going to look like this. We've got a bunch of beds that are closer together than we should be comfortable with. We are only providing face coverings, and we see that the most likely outcome was that nobody becomes infected, but the worst case scenario is that everyone becomes infected. And what happens if we start adding more interventions? If we require face coverings, we provide hand washing stations, and now try running it again, we actually see that help quite a bit. We still have that the most likely outcome is that nobody becomes infected, but the worst case scenario goes from everyone being infected to 2 of the 5 workers being infected. It ends up sort of staying just to that side of the room. So people can start to see how implementing these mitigation strategies would have an actual impact. And then going back to the conversation I was having earlier about multilingual, we did create Spanish versions of these websites, and we're even trying to be cognizant of the fact that a native Spanish speaker in the United States probably thinks in terms of meters instead of in feet. So, the units are flipped over to meters for this, just to be, again, more sort of familiar to somebody. Let me go back to my PowerPoint. So, So as I mentioned, this let us begin to probe some questions like, is there a worse, better bunk? We ended up using, and went back to my Matlab version of this to tinker with, is it, if somebody who ends up sick was in the center of the room, does that result in worse outcomes than if they were in one of the corners of the room? We can look at how does one manage risk? Are people concerned with the most likely scenario or the worst case scenario or percentages? And again, can start to feed people quite a bit of information that they can use based on their own value judgments. So this is essentially a simple agent-based model. For people who are in the modeling world, that may make sense. Agent-based models essentially just mean, sorry, that would be my husband coming home and my dogs are now going crazy. But so a simple agent-based model, logical next steps would be fine-tuning the parameters in the SIR type model. So we can easily tweak, how contagious the virus is, or adjust this based on the latest information coming out on any given pandemic. It'd be nice to reduce the dependency on that SIR type model and build out a model for typical day-to-day interactions, look at movements within the housing, account for airflow and fans and mealtime, transit to the workplace. So coupling this back to that bus model that I showed to show transit between farms and interaction between neighboring farm worker communities, and recognizing people will eat together or help their friends out. And then lastly, having validation data sets. It would be really, really nice to actually see how capable people are of socially distancing, which I expect is going to be very dependent on what it is that people are farming. Some products are easier to work kind of solo, and some products require more teamwork and people working more on top of each other. And then sort of as I wrap this up, we are planning an assessment effort in this coming spring to try to identify if farm workers are using this tool and if it's helpful, and if there are recommendations for improvement. So if you are listening to this and you work or manage a farm, if you're interested in being part of an assessment effort, please reach out. I would love to hear from you. I put my email address there. It's lmccuewe@gmu.edu, and my phone number, it's my office phone there. And acknowledgements. So the Northeast Center folks really are wonderful. I've been working closely with them on fishing vessel safety and now this farm worker work. Julie Sorensen is wonderful. Without her, the project would have happened. Margie Knight was an intern of theirs who brought incredible energy and creativity to this project, and really great ideas for the graphical user interface. Mary Ellen Driscoll is the person who I mentioned, who both works at the Northeast Center and it has a farm. And so she really was responsible for a lot of the wordsmithing that made for accurate but also accessible language. Paul Jenkins helped on the statistical side. Anna Meyerhoff and Jose Flores were the ones who provide the Spanish translations. And the work was supported by the Northeast Center. But everything presented is my opinion and shouldn't be viewed as theirs or NIOSH's or the CDC's. And with that, I want to open the floor to questions.
Well, thank you so much, Dr. McCue. That was wonderful. And I think I can speak for all of us. I really appreciated you walking through the simulator and through the tool. That was really informative and really great. So yeah, at this time, yeah, you can go ahead and put those questions in the chat and just type those in, and then Dr. McCue will see them come in, and she'll be able to address them as they come in. So we'll give everyone just a few moments to think about those and put those in.
So it's a great question in the text chat saying, any insight or thoughts on people rotating through a room for shift work? So 3 people staying for 3 days and then another set using the room for another 4 days. I do think, cleaning protocols are going to be what's really critical. I have not dug into that myself. I would definitely refer people to the literature that, hospitals and retirement communities have been doing in terms of how they are safely cleaning and cycling rooms for the next worker or the next crew. But that's a great question and definitely a pressing issue. Yeah, do you think it's applicable to the outside farm workers picking vegetables closely? Have you thought about modeling it? So what we're trying to capture for the sort of face-to-face interactions that people have, like when they're out picking vegetables, is that SIR type model that is how you would be modeling sort of a community spread from one worker to another. And so the way you would probably end up capturing people who are working more closely than other communities would be to be adjusting the parameters in that model itself to, adjust the infection rate to reflect the fact that people are in closer quarters. For the proximity-based model, I've been thinking about this some. I recently attended a webinar from the aerospace community that was talking about how the filters in aircraft make it so that the equivalent distance between people is actually much larger than the physical distance is. And so that proximity side of the model, I was thinking you could actually really easily tweak to just adjust what the critical distance is between people to represent that there's sort of an effective distance that is either larger or smaller between workers. But that's something I would love to dig into more. That is where I feel like we need some real data. I kind of feel like the dream would be to get some of those like spot GPS tracker devices and just ask a bunch of farm workers to wear them on their belt for a week and just see how often people are close to each other, not actually be like, not trying to invade anyone's privacy or make people worry that they have Big Brother watching out for them, but just trying to get a sense of how often someone picking vegetables versus somebody, growing hay or somebody who's working cattle, how often they are close to each other, how long they're close to each other, and sort of what types of abilities they have to be distant